Hello, welcome. My name is Nicole Lobry de Bruyn and I'm a veterinary behaviourist and I run the clinical behavioural medicine at Murdoch University for veterinary students, and I also have a private consultancy called Animal Sense. And I've been asked to do a talk for you on dog bite prevention for first responders, and I hope we get a lot out of this. So, firstly, why do we care? Well, obviously, it's important to prevent the physical injury to the staff. We want to prevent further injury to the patient if there's dogs in presence. There's also the best welfare interests of the dog in mind. We want to lessen fearful events for staff who might be involved with aggressive dogs, and we want to lessen the negative impact for the patient. In general, there's some risk factors for dog bites, and we see that dog bites are mainly to children between the ages of 5 and 9 who are boy children. Often the dog is known to the child, so it could be a friend's dog, it could be their own dog or a grandparent's dog. The dog might have some fear and anxiety that has previously been punished and therefore signals are reduced. The dog could feel tethered or trapped or be resting or sleeping. There's things that make your work very different. And you are entering a home without invitation often, as far as the dog's concerned. You know, you're being seen as an intruder by the dog, and you're kind of triggering because you look to them like some of the other people that they may be worried about. You might have heavy boots on, you might be carrying stuff, you'll have uniform on. The dog could already be fearful and stressed and aroused by the event that's called you in there, and then you're going to do stuff on a person that they may then feel as quite threatening to their caregiver, and who knows what experience they have in their past that may change the way that they experience the person that you are. So really, you're in a pretty difficult scenario. So what I'm hoping to do is help you read the dog body language so that you're in a better position not to be bitten. So let's begin. Now, this image here of the canine ladder of aggression gives you a kind of understanding of the low-level stress signs that a dog might be showing you before it steps up to more offensive style. I guess the thing to remember with this ladder is that not all dogs have read this handout, and if dogs have, again, been experiencing growls and had those growls verbally corrected or physically corrected, they may skip that part and head straight up to biting. So you don't know, of course, that the previous learning history of that dog, and so that can be quite tricky for you. But what I want you to think about is that if you're seeing low-level stress signs such as a dog that is yawning, licking its nose, turning its head away, trying to move away, creeping, ears back, things like that, you should realise that that dog is not a dog that potentially is safe to interact with. We're just going to look at the various responses to fear, anxiety and pain. And obviously you don't know, again, what level of anxiety this individual experiences, and you don't know whether this dog is a painful dog either, but you can probably imagine that it is experiencing some fearfulness. Now, if a dog is avoidant and avoids you, it takes control of that scenario and wants to escape the trigger, well, that's the safest for you, and that can make you feel less worried about the dog. But again, you need to remember that a dog that's using avoidance can swap from that avoidance to another response. The inhibited dog is a dog that stays within range to take the information in, but is really not giving any information out. They might be quite still. They also may be unsafe. Then there's the appeasing dogs, who are actively engaging and giving and receiving signals, often getting up very close, might be very licky, might be trying to sniff you and take information in from you, and often perceived as very excitable. These dogs may also be worried. And again, a change in the scenario might also change their reaction. The active dog that is using repulsion is driving the trigger away. You are the trigger, and they're the ones where a bite is more likely, and you will recognise those because they will be high up on the ladder and using growling, barking, snapping. So if another way of looking at this is the 5 Fs, you might have heard of flight and fight, of course, but there are freeze, fiddle, and frantic friend maker. So all of these are expressions of fear, and they can flip between these depending on what may be a better strategy at the time. So when we're trying to interpret a dog, we want to be looking at all areas that give us information, such as the ear position, eyes, tail, the whole face, and the whole body. So I'm going to talk a little bit about each of these areas, and then we'll watch some video that demonstrates, hopefully, some of these more clearly. So, ears. The ears will have a different capacity to move depending on the species, and so that can change the way that you interpret. But the ears being back, flattened, and more held close to the head is a more fearful dog. Whereas if the ears are more forward, then the animal is more alert and interested, more likely to come forward than go away. If you see the pupils and you can see the dilation of the pupils, then that dog is more fearful and more aroused and probably got more adrenaline going through its body. The whale eye is when you see some of the white of the eye, and it's usually because the dog is trying to avoid looking at you, and therefore we call that the whale eye, and that is a sign that the dog is trying to switch off the interaction with you. A hard stare is something that you more or less feel rather than see, because when it happens to you, the dog is probably coming at you, and it's something that you'll feel deep in your psyche, but you only realise it after the event. So the hard stare is a very dangerous moment. And contrary to all these things are the soft eyes, and I'm sure many of you that own dogs know what I mean by a soft eye. You get a sense that the dog is biddable and friendly by that soft eye. If a dog is panting, there is a sense of the dry pant. So it's and that dryness suggests an anxiousness. When we see repetitive large yawns in a dog, that can be a sense that the dog is trying to calm itself down, and it maybe is building in stress. Lip licking is also a stress sign, and they usually will close their mouth quite obviously before a bite event, and I'm going to show you some video of that. With body movement and tail, it's very important to remember that a wagging tail does not mean a friendly dog. A wagging tail means I'm alive and I'm willing to engage, and it doesn't indicate to you what that engagement will be. On the other hand, a tail that is tucked under and is held down is usually a fearful dog. The higher and faster the tail is, the more alert the dog is. This could also be a bite about to happen. Piloerection is the hackles that are along the back of the dog, behind the head and the neck, and also along the spine, and that can indicate arousal. And again, a dog with a lot of adrenaline going through its body. The more the dog holds its body lower to the ground, crouchy, the more fearful it is. Whether the body weight is backwards or forwards might indicate an intention. The ambivalent dog may raise a paw to say it's unsure and it's ready to move. And then what is the dog's general speed of movement? The faster it is, the more alert and anxious, but sometimes also they will move slowly, and when they're worried, they might hug the wall and stay away from you and stop moving. So with vocalizations, we have both vocalizations that intend to decrease distance and vocalizations that aim to increase distance. And by that, I mean the dog wants to get away from you versus the dog wants you to come closer. So obviously, increasing distance signaling includes things like growling, snapping, barking, and those lower tones are very indicative of a dog that is asking for distance. The decreasing distance signaling tends to be higher pitched, whiny, whimpering, crying. So type of noises, and those dogs are asking for you to come closer to them. Right, so this is a video here of a dog that is in conflict, in consult, and it is using avoidance, and when the avoidance no longer works, it switches to repulsion. And so this gives you a lot of the low stress signal signs before we elevate to the more higher ladder signs. So...
but not really with commands. Like he'll just fetch and bring back. Just any kind of like tutorials. That's about it. Got that.
I'm not sure what that. So if we look at that again, the beauty of this is the dog has run out of options as far as it's concerned. So without releasing pressure by giving the dog more distance, which was impossible in this space, what we see is a dog that has been averting its gaze, yawning, looking away, dry panting, ears back, change to ears forward, hard stare, closed mouth, attempt to drive.
Fetch, but not really with commands. Like he'll just fetch and bring back. Just any kind of like tutorials. That's about it. Got that.
I'm not sure what that is.
No, I think.
And another one where the dog starts in a different kind of impression, comes in very tail tucked, very avoiding, and a little while later ends up as more offensive. So, I mean, and so he's under social with the dog.
Yep.
So, then she picked some of this up when she had him. You know, I think
she had her own plans of keeping 2 dogs from each litter that she had to keep lines going, etc. So she kept him and his sister from the visitor. There was 11 puppies. He wasn't destined for the show room. She said it didn't like it, didn't have a temperament for it, and then she did nothing with him until 10 months.
So he may be growling and worried around judges, perhaps.
And she said that in 10 months she realised that he needed socialisation and needed home. So she advertised him from there.
Is that directed to you or me, do you think?
Hey.
Anyone that he's not, doesn't know.
So you can see what some of the body language signs there that change, where the eyes are dilated, the pupils are dilated, the ears come forward, there's a puckering at the front of the mouth, there's a quick change to come more towards the threat, but basically the dog is still very fearful. If we look at this scenario here, I think this is quite a good one because it might be quite similar to, say, what you might experience as a paramedic. Say you go into a space and there's a dog that is possessive and guarding of its human.
Can you have a look at this one? No. Hey. No. Stop. That's enough. 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 Stop.
So a lot of stress signs there, the vocalization, you can hear the growling. The dog is basically trying to split the person who enters the room from the woman on the couch. This is resource guarding the human.
Can you have a look at this one?
You might be able to attach a slip lead to this small dog and lead this dog out of the space if you felt comfortable enough to do that. And you might be able to lure away and put the dog in a secure place. But I feel like the dog will likely escalate if you made a closer connection with the patient here. So to really interact with that woman on the couch, we need to get that dog away from that human. And again, you know, we're going to talk about what you would do. Obviously, if there was this second person in attendance, maybe that person could be the one to actually move that dog away first before you entered, because that dog is likely to escalate its behaviour if you then were to do anything with that caregiver that's seated on the couch. In this scenario here, we have a scared individual interacting with someone that they don't know, and we have the owner filming it, the interaction. And I guess what's useful here is that I guess in a way you are this unfamiliar person, and this unfamiliar person does quite a lot of things that I wouldn't want you to do.
Who's that, Dig? Who's that? Good boy, Digger. Good boy. Good boy, Dig.
So the dog is able to get too close to the unfamiliar person, now finds themselves very up close to the trigger, again, which is potentially you, with a tail tuck and hackles, and then we hear the
Hey,
vocalization.
you're not afraid of me. Good boy, Digger. Maybe just give him a treat. Good boy, Dig. Good boy. Right.
So two things are wrong here: leaning over the animal, really reaching down with a hand with the food. If you're going to give this dog food, which might still be a good idea, you would want to drop it and be throwing it away from you rather than luring the dog into you.
Good boy, Dig. That's okay, we'll stop it. That's all right. That's all right.
So the dog is getting more and more elevated. The growling, you can hear that in the bark. This dog is very close to biting, and the woman is probably in the firing line here.
Let's ignore him. Good boy, Dig. Come on. Outside. What's going on, Dig? Good boy, Digger. Good boy.
So people are often confused why a frightened dog will pursue the thing that it's frightened of. Again, it wants to keep the trigger within distance. There's conflict here, both wanting information and wanting to avoid, but also being food motivated. I don't want you to lure a dog towards you with food. I want you, if you've got food, to be able to use the food to get the dog away from you. I don't want you to reach for any dogs if you can avoid that. I want you to recognize that the high arousal means that this dog is closer to biting. And think about, what you would do if this was your scenario. I mean, obviously, in your scenario, what I might do is I might be able to throw that food outside, get the dog outside, and then rapidly close that door. In this slide, we're going to look at a dog behind a barrier. So that body language tells you that this is fearful. We've got very intense ears back. Despite this fear, he's coming forward, and that might make you confused, really. Why? But the barrier will make the dog more offensive because he feels a level of safety behind this barrier, and he's more intent on showing you that you shouldn't come through it. And really, what would happen if you did open this sliding door? Given the fact that he can move away, he's likely to run, although I wouldn't test it because he is so fearful, and you don't know that he won't choose a different strategy. In this slide here, we've got a dog that is very still, and stillness doesn't equal calmness. This dog is on an adoption floor and is being engaged with a man that it doesn't know, and this inhibited look is a problem because we don't know whether the dog might get so fearful in this inhibited state that it chooses a different strategy. dog is way too stiff. The man's face is too close to a dog. He's got two hands on the dog and he's gazing into its eyes, which potentially is threatening to the dog. Frantic friend makers look like this. Again, you may misinterpret this dog as loving because he is seeking a lot of information from me, but this may not be, again, a safe dog to interact with if pushed.
Yeah, I read that he had a few allergies, and often we see that with anxious dogs as well. Yeah, had a bit of arthritis. So you like crocodile dogs, don't you? When they're
So you obviously won't be needing to interact with a dog like this, but what I would recognise is that this type of dog is not a calm dog, obviously. Now, there's many things that humans do out of their innate natures that are potentially threatening to dogs. And it's good to remember that as primates who like forward-facing eye-to-eye contact, hands reaching for and hugging, all of these things are potentially confronting to dogs and not acceptable normal dog-to-dog communication, where they like a curved greeting, nose to tail, and they really only do very quick early introductions with each other. And so if you keep that in mind, it might help you understand why you potentially are threatening to dogs when you don't intend to be. This is just to give you a trigger warning here, because this video is of a woman being bitten. This is a video of a news reporter interviewing a dog that was rescued from a fire scenario, and her interactions with it indicate that even though she loves dogs, she's not reading the dog's signals, and she puts herself in the firing line here.
When I heard he was coming on, I was so happy. I just adore dogs. But I'm especially happy to meet you after your story yesterday. He's a mastiff, right?
He's a Dogo Argentine.
Oh, okay.
So he's an Argentine mastiff.
Okay. You're gorgeous. You're gorgeous. Oh, I'm so glad you're okay. You too. Thank goodness for you. Gosh, have a great weekend.
Thank you.
Happy Valentine's Day. Oh my God. Yeah.
Okay. All right. Okay.
So a very scary scenario in that image, but again, things that she does wrong there is she's obviously right down in front of the dog's face, giving direct eye contact, staring at the dog, goes in to kiss the dog, has already two hands on the dog, and the dog is fairly restrained and feeling trapped by her coming in towards him. He's given her some off signals that she hasn't interpreted, and then he gives her a bite to the face. So, in terms of useful equipment and skills, obviously you can't get a dog to move away unless you have some way of moving it on a lead. Unfortunately, you probably are not able to have a slip lead with you in the ambulance, but maybe there is something that you can use in the environment. You may not be able to have treat food with you in the ambulance, but there may be some food available in the environment, again, that you could use to lure the dog away from the environment that you want to be in. In terms of what you've got in the ambulance, perhaps you have the makeshift barrier of the spinal board that you could use to put in front of you and to allow you to move forward with a barrier. Sometimes something as simple as an open umbrella can make a dog move away from you, and you can use that as a barrier. You could also use your equipment bag as that barrier in front of you. Sound devices can be useful to move a dog away, and you may not be able to have an air horn, but you might be able to clap your hands and make a noise to get the dog to move away from you. I believe you do have a fire extinguisher available to you, and that again might be something that you use to create ask the dog to move away from you by spraying the fire extinguisher. I'm thinking of the useful tools that you might have already in your space, such as the fire extinguisher and the spinal board. Could we have an air horn also located within the ambulance to drive the dog away if the dog is over a person? And do we have any access to food? I mean, if we're already in the client's house, perhaps we can get food from their fridge. Otherwise, we may have some maybe dried food inside our ambulance ready to use for the dog. So we're just going to look at some paramedic scenarios that were given to me by your staff. And we're going to go through them and see what we could have done differently. So, okay, there's a call for a patient who's fallen at the home, and on opening the door, the dog appeared. The dog presented as curious. So what might that mean? No lunging towards the crew. Is this curious dog, again, is this an appeasing, is this a potentially frantic friend maker? The crew called out to the patient, locating him at the rear of the property. The patient shouted, "The dog will be fine," to the crew. At this point, the dog ran off. So we've gone from frantic friend making to avoidant. The patient's sister was still on the call. She suggested the crew open the garage door and the dog will go in there. Despite this instruction, the dog did not enter the garage. So the problem there is what could have made the dog enter the garage with more cooperation, maybe some food thrown in there. The crew continued towards the patient and were able to lift assist the patient. They all then walked into the lounge room to carry out further assessment. So again, could we have avoided the dog coming in with us? Maybe. The dog bite occurred at this point. Both officers positioned themselves behind the sofa. Great. So they're using the environment. And the patient had a stick, which they used to gesture towards the dog for it to go away. So there's a lot of conflicted signs here. There's both avoidance signs as well. And if we'd maybe given the dog more opportunity to leave the space, maybe that could have worked. When it was curious, could we have slipped a lead over it to lead it out? Could we have used the food scatter into the garage? Obviously, there's a good use of the sofa as some protection. But again, it wasn't foolproof, was it? Right, the next one. So attended the property with the dog, and the dog was on a table in the balcony barking. So the crew kept the eye on the dog during the patient retrieval, and the patient stated the dog door was locked. So that might have been the first thing to check that that was indeed locked. The dog turned, saw the crew and entered the room, and the door was not locked. The crew member put out the left arm holding the patient's bag and put the right arm out straight with the palm facing forward and started to yell at the dog, "Stop, stand down." Yelled this a number of times as back down the hallway to where the front door was located. So I'm thinking that they're facing the dog, which again is a good idea, not to turn your back on the dog. The dog came towards them aggressively, barking, growling, showing sharp teeth, so using repelling motivation, grabbed at the bag and tore some of the bag off, kept grabbing at the bag until the crew member could get close enough to the front door and throw the bag to distract the dog. And with the dog being distracted by the bag, they were able to exit the property through the front door and close the door to create a barrier. So they did quite well with their escape. I guess the first thing might have been best to do would be to check that the dog door was indeed locked. Remember that yelling the dog could make the dog feel worse and more threatened, and so yelling stop and stand down might not have been helpful in this scenario. Once the dog's in this state of arousal, probably nothing is going to make the dog feel safe. The dog's using repulsion, the fight strategy. It was a good idea to use the bag to protect themselves, and the dog will bite the first thing that's presented to it. I would probably keep the bag in front of me rather than throw it, because the dog is still after, the bag is providing you some protection for your body. Right, the next scenario. The patient was laying on the footpath unconscious. This is a very difficult scenario because we don't have anywhere we can confine the dog when we're outside of our property. The dog is with the patient and attached to a lead. The lead's held down by the body weight and the dog seems restrained, and the bypassers call the crew and tell them that the dog's been fine. On approach to the patient, the dog launched at the crew and attacked both workers. We don't really know what the attack refers to. It's always a good idea to get more information about what their dog actually did. The ranger was called, the police were called, the dog was identified as dangerous, we'll talk about that, and not muzzled. And only on initial assessment, the dog was not aggressive and only attacked when approached. I guess the scenario, of course, is that the dog feels that it needs to use that strategy. So the being on the footpath gives little options for a safe place to put the dog, but the dog was already attached to a lead. So that is of some benefit. Given that the bystanders called the crew and reported the dog had been fine, I wonder whether one of the bystanders could have removed the dog from the patient before their crew attempted to move towards the patient. If the dog is guarding, I would not approach. I would stop and I would call the police ahead of that, because really I don't see how you can de-escalate this once the dog is guarding the person on the ground. Any dog can be dangerous, and any dog could do this. When we say the dog was identified as a dangerous breed, does that just equal its large size? Again, very many non-declared dangerous breeds, such as German Shepherds or Rottweilers or blue heelers, or any dog could really do this. We don't really consider this a more likely because of the breed of the dog. The dog was using repulsion and fight methods. I do wonder whether the food scatter might have helped in this scenario. Could we have lured the dog away with some food? And like I said, could we have been led away by others? Okay, we've got another scenario here. The next one is the scene. The patient was restraining a dog that was growling. The patient left the dog inside and was assessed outside. So the dog is free in the house. The crew then went in later to help the patient, and the dog was shut in a separate room. So here's where our thing has fallen down. The dog was not shut in the separate room, but managed to escape that room, come round, proceeded to growl, and then bite at the uniformed pant leg. Again, with the positioning of the furniture, there was no easy way to step back. The patient managed to grab their dog, and the crew made quick movements to remove themselves from the house. So the dog was using repulsion and fight. The growling is, again, the distance increasing signal, which says to you, you need to give the dog space immediately. If the paramedics were able to give that dog space, would that de-escalate him? We would want to be more sure when we entered that home that the dog was securely placed away. Maybe knowing that there is a dog in the home and we're not sure how securely placed away it is, do we enter with a barrier that we can use for protection? So would we take the spinal board with us? Would we get some of our dog equipment ready? So when I tried to look at the commonalities of these scenarios, what I could see was that the dog was often not secure ahead of entry. And I know that this is the difficulties of your work. And I know that the phone operators ask about a dog and ask that the dog be secured away. I guess, do we ask that again before we enter? Are we more insistent on that from the beginning? If the dog is already high on the ladder of aggression, showing growling, barking and lunging, do we not enter the home? Because if the dog is in those high levels, you're asking it really to do more than that, because you are not listening to those signals. If the dog is unrestrained and you enter, and the area is not secure, I think you're at a high risk of being bitten. Right, so if the dog is unrestrained and you are in the space, what is going to be your best approach? Well, I think firstly, if you know the dog's name, if the patient is there and you can ask the dog's name, you can use the dog's name and you can speak in happy tones to the dog. Say, you want to go for a walk? Let's go. Come on, he's a good dog. Trying to de-escalate any fearfulness that the dog feels. Again, if you've got food, you can scatter in the direction you want the dog to go. We can try and direct the dog away from the patient. Perhaps we can open a back door and get the dog out of the space. We can open a bathroom door. We can get the dog away from the patient. If the dog is threatening, we want to give the dog distance. We want to avoid a front-on approach. We want to avoid staring at, reaching forward, leaning over. Before working on the patient, we really need to get the dog in the secure area so that we feel that we can do our work, because you're not going to be able to get down on the ground with your back towards a dog that is behaving aggressively in front of you. What happens if it really goes wrong? Well, most dog bites are to get distance and are not really going to hang on to you. They're going to bite and back off. So most dogs are not this dog who is taught to bite and hang on. That is really not the most common scenario at all. And most dogs are trying to get distance from you. So if a dog does bite you and is hanging on, then do not struggle to get your limb back. That is when the most damage is done. You really need to not engage in a tug with a dog, and the team should not pull the dog off you or pull the person, but instead use some other method to stop the dog, be it sound, water, spraying the dog, really hitting the dog or kicking the dog as an emergency to break the holding action. There is no such thing as a lockjaw in a dog. The dog is holding on because it is highly motivated to grab. A stick behind the canine teeth to break the bite, as in a break stick, can be used, but this really is something that only I suggest a dog professional do. So I'm not thinking that it's something that you're going to be able to do as paramedics. And so obviously you really need to call the police. You don't have any really equipment that you have in your ambulance that you'll be able to use in that event. I'm going to show you a video now of from the police department where a dog is some dogs are attacking a policeman, and it's quite good because he de-escalates the scenario quite well.
Come here, puppies. Come here. Come here, puppies. Hi. Come here. Come here, puppies. Come here. Hey. You're okay. Get back. Get back. Hey, get back. 1266, can I get a code one, please? Hey, get back. Get back. Hey.
He has a baton that he's able to use to get distance from the dogs as they're kind of coming towards him. So again, if you had some equipment like your bag, you'd be able to kind of wave that in front of them to give them some sense that they couldn't come in towards you. Obviously, 2 dogs is worse than one dog because there's a social contagion where they're both egging each other on.
You're not gonna like me. Hey. You're not gonna like me. Settle down. Sit. 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 Hey, come here. Are they your dogs? Oh, you guys may want to get inside. They're not very friendly. Here, puppies, come here. Sit. Sit. Hey, sit. 1966, can I get an animal control to my location, please? Come here, puppies. Come here. Hey. Come here. Come. Come here. Come here. You guys smell it. Hey. You're okay. You're okay. Settle down. How about you sit? How about you sit? You wanna go for a ride? Do you wanna go for a ride? Huh? Hey. Go back. Go back. You don't like it. Hey. Get back. Yeah, it's not very nice, is it? Hello. I got some vicious dogs. You're probably not gonna want to. You're gonna want to close that gate. What's that? Yeah, they're kind of vicious. So I'd close the gate and stay inside for a minute. Get back. You're going inside my car. You wanna go for a ride? You wanna go for a ride? Come on, let's go for a ride. Come on, let's go for a ride, guys. Come on, let's go for a ride. Load up. Let's go for a ride. Come on, let's go for a ride. Load up. Load up. Load up. Load up. You can go in there. Load up. Good boy. Load up. Good boy. Load up. Load up. You're okay. Load up. Load up. How you like me now?
So the beauty of that was that he kept everything quite controlled in that he didn't, he really used a lot of calm body language. He used calm voice. He tried to engage the dogs in some cues that they might know. He tried to de-escalate it and then was able to get the dogs into a safe, confined area. So that was really good. And I mean, obviously he's a policeman, and his job is different from yours. But I think you can probably take away some nice messages from what he did. I think that's where we finish it today. So I'm giving you some further references here. This video, When Shit Hits the Fan, by Michael Shikashio and Trish McMillan, talks a lot about handling shelter dogs, but it certainly gives you a lot of techniques for actual handling, which again I don't think you're really involved in, but for those that are really interested, it might be good. We've also got some thank yous there for some of the videos. So again, my pleasure. It's been my pleasure to do this talk for you guys, and certainly available to take any questions through your occupational health and safety officer, also through our website, Nicole at animalsense.com.au. Thank you very much.